So then what happens is we move into adulthood with this very kind of rigid way of being, a lot of us, but we don't even know it. And that causes a lot of suffering, and usually the suffering manifests in what the psychiatric world would refer to as symptoms, depression, anxiety, sleeplessness, stress. And those are things that can be addressed in large part by therapeutic work in which you uncover, and this was the case for myself, uh, beliefs that you have about yourself, ways of relating to yourself and other people, relationships in your life that are in some way hurtful or not fulfilling, that are in some way limiting who you really want to be, who you really want to surround yourself with, what kind of job you really want, where you want to live. And getting in touch with those really core needs that have kind of always been there since childhood uh, allows people suddenly the ability to choose what kind of life they want to have. So transformation begins with an awareness and a deepening into who you actually are and not who you've been told that you need to be. And that process of being told who you need to be, that happens in our families of origin, and it happens on a cultural level as well. We're constantly being sent messages about how to be successful, how to look. In the United States, there's a lot of messaging around being positive all the time. Um, be really plugged in all the time, be on your phone, work 60-hour weeks, these sorts of things. And it's taken for granted that that's the way that we need to be. And in fact, every person is different, and every person has I think, a vision, a unique vision for how they want to live their lives in a fulfilling way. And therapy helps uncover that and get in touch with that. And so ultimately, it's a process that allows you to live with more clarity and joy and authenticity.